you can't really address health issues without addressing nutrition and the diet. Got to realize that either your patients are not really getting better and turning things around, right? Or perhaps even some of what you're doing is contributing or even the primary cause of the problem. We diagnose depression, but we don't really define what that is, and it's basically anyone who is dealing with any life problem will just get that slapped on them and then they get put on a drug. I saw that by keeping them on these drugs, you actually increase the chance that they're going to get more depressed. Because as psychiatrists, we're expected to actually use our police powers to imprison patients for their own good, allegedly for their own good or to protect the public safety.
So welcome. I've got Dr. Andrew Kaufman with us. Andrew, I saw you said you were an escape physician or something along those lines. You escaped the system or something like that.
Recovering physician.
Recovering physician, I get it. Yeah, sometimes you figure things out despite being trained in medicine. It's funny. I can somewhat say that sometimes. I guess for those who are familiar with this, maybe share your background a little bit.
Yeah, sure. I started off my career to become a scientist, really. I went to MIT and I did research at the bench in academics and then in the biotech industry. But I really wanted a clinical experience. And around that time, there was a major increase in people going into medical school. So I decided to go the physician assistant route initially. And so I did that, was at the top of my class, and I went to work as a faculty member in South Carolina at the medical university there. And after 2 years, the fellows, and I was working in hematology and oncology, the fellows said, come with us. And they walked me to the medical school admissions office and said, it's time for you to go back and become a doctor. And so I ended up doing that. But the experience I had in hematology and oncology was really pivotal for me because one, I got to really learn a lot of skills in the trenches because they were some of the sickest people in the hospital. I was on a first name basis with all the ICU doctors and had done all kinds of procedures and dealing with life-threatening situations. But I saw that the outcomes were so poor. At best, someone would get a respite before they got sick again. And I'm talking about things like acute leukemia, which was bread and butter of what kind of patients I was working on, doing bone marrow transplants, and people with rare blood disorders, which was quite interesting. And in retrospect, Shawn, I recall that there was a certain subset of patients who recovered fully from leukemia. And they had a type of leukemia known as AML-M3 or promyelocytic leukemia, if you remember that from medical school pathology. And in that case, we gave them basically a version of vitamin A. And they were there weren't too many. I only saw 2 or 3 cases over the couple of years I was there because we were the tertiary referral center for virtually the whole state of South Carolina. That's why we had so many cases of that, even though it was only 2 or 3. But those people, everything just turned around and they had normal health afterwards. And it never really struck me until looking back when I discovered natural healing later on, that was the only kind of natural treatment that we gave to all the cancer patients. And in medical school, which I started in 2000, that's when I first started researching nutrition. And I've been studying nutrition since then, almost continuously. And my first exposure was to Dean Ornish. And I'm sure you're familiar with the ultra low-fat diet.
Right, sure, yeah.
And my wife and I at the time, we actually did that for several months. And it was not very pleasant because everything tasted like cardboard without the fat. But we did lose weight, but we eventually went back to a more reasonable diet. But I've studied many people since then, Robert Lustig and many others. And I've also lived life on a number of different diets, from vegan to vegetarian to frugivore to a couple of different variations of carnivore. Of course, I had the standard American diet all my childhood and my earlier adult life. but it's been an intense interest of mine. And I realized that it's paramount, like that you can't really address health issues without addressing nutrition and the diet. And while it may sometimes not be the only thing that can turn around a serious health condition by itself, it's always an integral part of the equation. And even in the natural healing world, I see lots of people selling a bunch of treatments that don't involve adjusting the diet. And so I know instantly that's not going to be successful.
Yeah, you don't stop. I think what I like to say, you don't stop poisoning yourself, does more what you end up trying to get, right? And then I think, unfortunately, it just has gotten so bad that it's killing the poisoning. One of the things, and I appreciate, one of the things that's frustrated me over the years as I've gotten more into this is that we do have these sort of published spontaneous remission rates in various conditions, whether it's MS or certain types of cancer, like you mentioned, or mental health disorders. People just get better. And there is a profound, complete lack of curiosity by the treating physicians. I see people all the time, they cure their Crohn's disease, and the physician has, oh, good, keep doing what you're doing. No real desire to know what's going on. And it seems rather than just saying, oh, 5% of people spontaneously admit, we should be studying the heck out of those people and seeing what's going on. It seems like there's some value in that, but that is not. And as a physician, you just don't, it's not time. A lot of times, outsource start thinking to other people in many ways, how to advance the profession in many ways. That's what I'm saying. I appreciate you learning.
Yeah, just to comment on that, I think there has to be either some degree of willful ignorance or just simply being narrowly focused on following your practice guidelines and only measuring what the system wants you to measure. Because if you're practicing as a physician and you're following the standard of care, you've got to realize that either your patients are not really getting better and turning things around, or perhaps even some of what you're doing is contributing or even the primary cause of the problem in the first place. I'm sure you, for example, as an orthopedic surgeon, that you saw many of the patients, it was a result of their lifestyle choices that led them into the operating theater and not a car injury or a sports injury, although I'm sure you had plenty of those types of patients as well.
Yeah, in fact, one of the reasons I chose orthopedics over, say, primary care was that I felt that what I was going to do was, it wasn't dependent upon their compliance or their lifestyle, naively thinking that. And then as I was in practice a decade or so, I started to realize all this arthritis and tendinopathy is lifestyle related. And look, this could be avoided or in many cases reversed with the right interventions there. I didn't realize that until much later. And that's something I used to almost, I would say, ridicule with patients, but I would be very skeptical of any patient came in saying that this sort of lifestyle food, for instance, would bother me. And I'd say, yeah, whatever, you're not crazy. You just go on with my mindset that I'd been trained to think. And then when it turns out that, gosh, I was probably the soul of it, didn't sort of pay attention to that, but eventually you turn it around. So what was, you said you recovering physician, what was the event or set of the events that led you to, I assume you're not like liable to like, the main way we practice medicine these days.
Yeah, that's correct. And it's interesting because what really started me off on this path was participating in a required journal club at Duke when I was in residency there in my first year. For the first 2 years, you're required to attend this. And we had to do what's called a critical appraisal. So they would choose usually clinical studies in psychiatry and assign them to different interns and residents each week. And we had to really dissect the methodology and the reported data analysis to see, was it legit? Were there biases in the study? Was there statistical tricks that were used? And they actually taught us how many of these authors use those, even though people in our own department at Duke were doing the same thing in their publications unwittingly. And we ended up analyzing this study that was done by a statistician, I believe at Harvard, where he, through a Freedom of Information Act, got all of the unpublished and published data from antidepressant trials that were submitted to the FDA. And this was basically new data because it wasn't published, because when they do clinical trials, as if they don't have positive outcomes, they don't necessarily publish them. So we don't see those. But they're obligated to submit it when they apply for FDA approval. So when this guy analyzed all the data together, there was no difference between placebo and SSRI type antidepressants. And in this journal club at Duke, we all agreed on that conclusion. But then 30 minutes later, we were expected to prescribe those exact drugs to patients as a first-line therapy in the clinic. And this contradiction really stuck out with me, that I'm like, why aren't we integrating real knowledge that we all agree on into how to help these patients? And then I began to observe that all of the patients with problems in their lives, really, because we diagnose depression, but we don't really define what that is. And it's basically anyone who is dealing with any life problem will just get that slapped on them, and then they get put on a drug. And that was not serving patients. And when I dove deeper into the research, I saw that by keeping them on these drugs, you actually increase the chance that they're going to get more depressed, and that they can actually develop suicidal thinking and behaviors just from the drugs, which I didn't even think it was possible that a drug could do that until I saw a string of teenage girls who had described that experience to me when I didn't even ask about it. And then when I took them off the drug, they stopped thinking about suicide. I couldn't really go on putting people at risk. I even learned that antipsychotics and antidepressants clearly shorten your lifespan. Antipsychotics are a leading cause of sudden death in teenagers, done in a huge study in the entire state of Tennessee. So I had to stop giving these poisons out. And while I was still practicing, I was basically working with troubled teenagers and tapering them all off all psychiatric meds, trying to work with them in other ways.
So you started out in HEMOC as a PA, and then when you went into your residency, what were you in psychiatry, or what were you doing at this point?
Yeah, I realized that what I really enjoyed about working with the cancer patients was the end-of-life bereavement work, which was required because most of them ended up dying in the near future. And when I was exposed to psychiatry in medical school, I was just attracted to that and felt like I liked working with difficult people, with weird people, observing all the realms of behavior. And I just had the skills that I can calm down and relate to crazy people a little bit better than the average guy. And so I went into psychiatry and then ultimately into forensic psychiatry, where I was just loved to debate and understand the law. And mental health is unique in how it interfaces with the law, because as psychiatrists, we're expected to actually use our police powers to imprison patients for their own good, allegedly for their own good, or to protect the public safety. And that's a unique situation, and it was very uncomfortable for me.
Yeah, I can remember I guess it must have been medical school, when I did my psychiatry, what I would expect it to be, and told me sort of it was. And I remember we went to a forced medication hearing where they were trying to, the lady was allowed to defend herself, but she was obviously just way out there, so they ended up doing that. I remember, because I was a big, strong guy as a medical student, I said, "Hey, can you just hold this person down while we forced satin with Haldol," or whatever they were doing at the time. I can't remember, but it's interesting. One thing that I've seen in my experience with just talking about nutrition and seeing people, that there has been a profound impact on mental health when people change their diet, whether it's depression, bipolar disorder, anxiety, Tourette syndrome, which was really bizarre to me to see that get better. And you may be familiar with the work of guys like Chris Palmer and some of these other folks talking about, but we talk about metabolic therapy for mental health disorders. This was something that even 5 years ago, I can remember talking about, saying nutrition impacts mental health disease. And people get really angry about that and say, like, "Oh, it doesn't. It's trauma, and you can't discount all this stuff by just doing something the right way." And I'm like, "Wait a minute, this stuff's like, well, what have you discovered in this time over the years with the Barca things outside is putting people on SSRIs or on mood stabilizer, lithium, things like that?"
I'm so glad you brought this up, because it's really where the money is, and where I started learning how to really help people and what it takes to heal from any issue. And one of the principles is that you have to determine the root cause of the problem and the contributing causes. In every case, it's going to be different. And it's always, even in a problem that you think is purely physical, in my opinion, it's always going to involve three aspects: that there's going to be a physical, a psychological, and a spiritual component. And by spiritual, you could just think about that as existential, right? It doesn't have to involve religious doctrine in any way. And I'll give you two examples, because one is the first time I learned that actually through a diet intervention only, you could affect mental health. And it was with a colleague, a social worker who had a chronic anxiety issue. And she went to all kinds of doctors, therapists, psych meds, endocrinologists. She had a Holter monitor, right? And nothing solved the problem. So I read this book, and she recommended an elimination diet, which was based on Dr. Nicholas Gonzalez's work with cancer patients. So I did this elimination diet with this woman, and she had a complete remission from her anxiety. And it turned out that when she challenged herself with other foods later, that it was gluten related. And not only that, but if she ate bread and pasta in Italy, she didn't have a recurrence of anxiety, but in North America, she did, right? So it's something specifically about how our food supply has been deranged. So in that case, it was primarily a physical issue that was causing the anxiety. Now, another case, a client came to me, and she was the matriarch of a large family, but in her later years, and she had a recurrence of panic attacks that had plagued her whole life. And in that case, it turns out that she was the victim of a practical joke when she was a teenager. And it was that trauma that came up every so often in her life and caused her to have panic attacks. And once she recognized that connection, boom, the panic attacks went away. So here we have a primarily psychological cause in one case of anxiety and a primarily physical cause in the other case, right? So we have to really look at this through all lenses. And of course, if we adopt a proper healthy diet that provides the nutrition, even if it's not a primarily physical issue, it increases our resilience to be able to think more clearly so that we can get to the psychological or existential cause. And furthermore, for people who have been dependent or stuck on psychiatric medications, because when they try to get off, they experience withdrawal, and that can be very severe, going on especially a high-fat diet will make it much, much easier, because their body will have the right raw materials to rebuild the damaged areas of the brain that have atrophied, because that the brain is mostly made of fat and cholesterol material.
Yeah, that's the one unique thing I've seen, is that people with really any sexual nervous system related disorder, whether it's a mental health illness or some degenerative issue, I find that higher fat seems to be more efficacious than the magnolic origin of any form of diet and hormones. That's just been my direct observation over many years now with thousands of people. But correct me if I'm wrong, but there has been a fairly significant increase in the prevalence of almost all mental health disorders. Correct me if I'm wrong on that. Can you postulate on why you think that is, and you think that are just deteriorating? You said basically, I know I described the diet, but has our diet changed that? And say,
yeah, there are several different factors, I think, that are at play here. One factor you have to look at is more of a detection bias, right? Which means we are looking for and we diagnose mental health much, much more than we did in the past. And it's mostly in primary care that these diagnoses get applied. And that is a direct result of the marketing and availability of the modern psychiatric drugs, right, which came out initially with Prozac. But we saw, you can look at the number of prescriptions for antidepressants, for, of course, psychostimulants, which is really uppers, amphetamine, which are prescribed for ADHD, and of course, antipsychotics, which are they're in the top 10 grossing drugs, antipsychotics, and it's not for schizophrenia. It's like they're being used as sleeping aids and such. It's really problematic. So because of the availability, there are many more diagnoses, but we can look at some of the analysis and see also the amount of psychiatric or mental health disability has increased despite the availability of these wonder pills as well. And I think that certainly diet is part of the issue, which has really been a problem since Kellogg and the Industrial Revolution and the industrialization of food, which has both stripped nutrients from it and also made synthetic chemicals considered food products. And that, of course, has been increasing, especially with the whole sugar and fat psyop, if you will, or conspiracy with the food industry and the medical industry to decrease our cholesterol and give high sugar, low fat snack foods and popularize those and demonize fat and cholesterol. So all that's contributed, but there's also been a lot of cultural factors. Right. There's been the fallout from some of the sort of feminist type policy changes, which changed the roles in the family, increased the divorce rate substantially, made families dependent on strangers for childcare. And then even more recently, working from home. Now you're out of the office. There's limited social engagement. You're more isolated, right? More things occur virtually than in person. So we become less and less human. We've gotten further and further away from our connection to nature, living in artificial environments all the time and moving toward even virtual environments. So I think all of these factors contribute. And I didn't even get to addiction and all of the addiction that's promoted, like through to social media and things like that, shopping, spectator sports, gaming, all these kinds of things, in addition to the availability and more wider acceptance of recreational drugs.
Yeah, it's just interesting. You think about what the human existence would have been like. You increase civilization, you wouldn't have that many options. I was thinking about what would be my entertainment back then. Might have been watching the sunset and wrestling and maybe telling some jokes or something like that. Now we've got this constant endless stream of visual stimulation and a lot of device spaces going on right now. But what about, as far as you said you're a recovering physician, what do you mean by that? What is it? What does that mean to you now?
That, of course, is a little bit tongue-in-cheek, but now that I can objectively look at what I was trained to do, is I was misled about what really causes disease in the first place. I was misled into the cut, burn, and poison model of treatment, which is, it's a business enterprise. And we can even look back historically to the Flexner Report, which was bankrolled by some of the big robber barons, right? Rockefeller. And it was essentially used as propaganda to change medical education in this country. Before that, it was largely naturopathy and homeopathy were the predominant paradigms. In fact, in the 1800s, allopathic physicians, what they were prescribing was mercurials and arsenicals. Like even a teething baby, they would give basically mercury tablets and say to keep giving it until the baby got diarrhea. So in other words, until they had significant GI toxicity, and then it would basically divert them from the teething to now being miserable with diarrhea and being poisoned with mercury. And so they didn't garner a lot of trust. They didn't have a lot of success until this report came out. And as a result of this report, the number of medical schools that taught homeopathy and naturopathy went down to practically nil. And the allopathic schools expanded, and they were now had a certifying agency because the AMA heavily lobbied the government until they made this come out. And then they, of course, put people on the boards through charitable contributions to all these schools so they could represent the pharmaceutical interest, because the pharmaceutical industry, it came from two places. It came from the chemical dye industry in Europe. And for example, for antibiotics are derived from dyes. That's why if you look at many antibiotic capsules, you'll see some brightly colored substances. So sulfa drugs, for example, they were originally synthesized as dyes, and it was observed that microorganisms died when they dyed tissue with them for anatomical analysis. And then from the petroleum industry, which was new burgeoning industry and developing into a monopoly for Standard Oil, that the first sort of health product was Nujol, which stand for new oil. And I think it was used as a laxative. Now it's mostly used to make different microscopic presentations, but many pharmaceutical drugs are synthesized from petroleum products.
Yeah, so that Flex report, correct, that's by 1940s or something like that. I can't remember when it came out.
Yeah, a little bit earlier than that, but yeah, right around the time the Federal Reserve was established, interestingly.
Was it Jekyll Island or something like that?
Yeah, exactly right, Jekyll Island.
We've got, obviously, I assume, I went to medical school, University of Texas, and a lot of my education, as I look back, I remember as a medical student, the pharmaceutical reps are giving me free pens and feeding you pizza. Look how good they are. This is it. It's like when you're a student medical student, you're like, oh, hey, I got free food. Everybody can buy me. You can grab me pretty easily. But when you think about how entrenched is pharmacy into medical education when it comes to primary education, it's not the student. It's all the CME, continuing medical education that's required, and probably all the algorithms are driven down by AHA, psychiatric. I don't know what psychiatric equivalent is. I can imagine. Is it just completely inundated with that? Is that fair? Is that a statement?
Yeah. This is something that I've definitely taught a lot. And I would say first look at Marcia Angel, because she was the editor-in-chief of the New England Journal of Medicine. And she quit because they made a decision to start accepting ad revenue from drug companies, right? Who had been trying for a long time to get into the New England Journal. And then she wrote the book, The Truth About the Drug Companies. And I think you should definitely look into that. But personal experience, I actually was invited to give a talk by a drug rep back when I was a PA on anemia of chronic disease. And it was from the company that made Procrit, which stimulates red blood cell production. And I didn't really know what I was getting into, because I thought, oh, these guys are great. They're friendly. It was going to be at a dinner at a fancy restaurant, and I'll give the talk and all that. And after we agreed and I signed a contract, he gave me a slide deck. And I didn't realize that I had to use that, right? So I looked at it and I'm like, this is a marketing fluff. I'm just going to put that aside. That was probably optional. And I really tried to give an academic talk. And I realized that I was never invited back. And looking back, I'm like, oh, it's because I didn't present the marketing material. I was just basically a paid advertising person. I was like, and I'm not a doctor, but I play one on TV kind of guy, the opposite of that. And that really clued me in, and I started learning about it, and, saw these surveys where doctors believe that they're not influenced. But obviously the drug companies wouldn't do these things unless they were influenced to the doctors, because it wouldn't add up to their bottom line. And companies don't spend money when they're not getting return on it. They might try something, but they are not going to keep with it. I saw this thing, it's a total racket. And really what it is like the medical industrial complex, that the health insurance companies, the big providers, like the owners of big hospital systems and clinics and such, which is these days every academic medical center, right? They own all these clinics in the suburbs and dialysis centers and such, that they're all really in cahoots with each other, supporting the same model. And you'd think they were competing, right? Because the hospitals want more billing, and then that will cost the insurers more money. But they've got it worked out how to do it to their mutual benefit. And it's not to the benefit of the patient.
Yeah, it's disheartening just to see that. And when you kind of look behind the curtain and see what's going on, I have no words. I mean, insurance companies be trying to keep the cost of healthcare down. And in some ways, they're not. They make more money when healthcare costs more money. It's just, in some ways, it seems insane to have the system that you have today. So what does your day-to-day look like today now? Because obviously you can't just, once you realize this, and I realized this, I don't know, 10, 12 years ago, I just couldn't live with myself in that model. I don't know, how do you get by these days?
Yeah, that's exactly what I was experiencing. So, like I was saying, I was just taking all of these kids off psych drugs, but I couldn't really do the right thing, right? Like the dietary services, this is a residential facility, they wouldn't work with me. And they were just feeding tons of sugar and processed food to these kids, thinking this is the cheapest way to go, right? While meeting the pyramid guidelines or whatever. So when the pandemic happened and they wanted me to wear a mask, and I had already started speaking out against what was going on, I just said, no, you can't require me to do that. I can't do psychiatry through a mask when people are telling me of their intimate secrets or about their sexual trauma. And so they terminated my contract. And that was like an opportunity for me to just go out and do natural healing consultations. And fortunately, the community that was looking at some of the things I was presenting about the pandemic and about other aspects of medicine in a critical way, they really just embraced this idea. And almost overnight, I was able to start working with clients, and people had amazing results. Nothing like I experienced working as a regular doctor. And of course, these were folks that came to me that already were thinking that they weren't getting results from mainstream medicine. They didn't think it was right. They were willing to look outside of it. So it does require that to be able to follow through and obtain the kind of benefits that are possible. But these days, so more and more people are thinking that. And so I decided to just, when my license came up for renewal about 6 months later, I just let it go, let it lapse, so that I would be free of that contract, that I wouldn't be bound by it. And the way that I work with folks now, and it's multiple ways, because I do a lot of education to bigger groups, like through online workshops with written protocols and lots of other resources, and even in a membership community. Day to day, I spend time researching different topics because I'm always trying to learn new things to have a better overall understanding of health issues. 1 day a week, I work with clients in a limited capacity, 1-to-1. And so for me, it's a much more rewarding experience now, because the people that take advantage of this information just do so much better. Almost every health condition, just like you've seen with the carnivore diet, that things that we're taught will never, ever get better in medicine. We see people left and right turning it around, like even people on dialysis restoring their kidneys to perfect health. So that's what my life is like now. And although I face a lot of censorship, criticism, and alienation from the mainstream, having this new community and these kind of outcomes with people who deserve it is just a far superior way to go.
Yeah, I feel your pain. It's quite difficult, quite simple like that. But I think that one of the things that, as you mentioned, we had this COVID sort of fiasco and influence. A lot of people no longer trust these institutions anymore, whether it's the FDA, the CDC, the primary care physician, hospital systems. And I think that's honestly a good thing. I think they need to be brought to accountability or held to account, because for years they have been doing things that are not in the best interest of the patient. I think it's the bottom line first. And if the patient happens to get better, that's a nice side effect, but it's not the primary focus, unfortunately. And I will echo your sentiment that it is infinitely more rewarding to practice outside of that sort of ethically compromised system and have the freedom to actually reverse disease, cure disease, to actually have that discussion. I remember when the term disease management came into the medical parlance. That didn't exist maybe 40 years ago. We weren't talking about disease management. And I remember sometime early in my medical career, this term disease management started popping up. It was, that means we're just going to put people on drugs forever, right? That's really what that is. And to say it is what is primarily taught, and people, unfortunately, I feel sorry for the kids who go to school today, out of this school, because they're sort of endless system that they can be changed from within. That's why I think we sort of coming at it from a different angle. Yeah, you may be the pariah to most of the position. I think you said nut quack, nut job, dangerous, blah, blah, blah. Yeah, I'm dangerously getting people healthy. not even making medications and new services anymore in many cases. And that should be the whole position that people not need to be listening very much, I think. So how do you, are you doing things digitally online? Do you have a local place, or how does that work for you?
No, I really do everything online. And so I have clients from all over the world. I work with people in Africa, in the Far East, Australia, New Zealand, all over Europe, Canada, Mexico. And it's really amazing, actually, to realize that your voice can reach that far, and that it's a universal human condition, that health is important and the healthcare systems are subverted to a large degree worldwide. Even during the pandemic, we saw a few rogue nations stand out, like Madagascar, for example, right? That they had their own natural remedies that they wanted to use, and look up in the headlines how it worked out for them. But so having that kind of broad reach, and then that way the people who are really open and motivated to do this can get in touch with me. Whereas I live in a semi-rural area, so I don't know how many local people. Occasionally one does get in touch, and I do arrange to meet with them in person. But usually the way to interact is probably similar to you, where I speak at a lot of conferences, and I love meeting people live in the flesh at those. But I find when I was exposed to this really in my training at Duke, when I had to do telepsychiatry because they had a special clinic to serve the rural population because there were no psychiatrists out in the country in North Carolina. And I saw that you could do it very effectively. Like, you can even feel the emotional state of the other individual, right? We call that transference in psychiatry, even through this virtual means. It's incredible, actually, that you can do this, right? Because I want to be able to criticize that. Why aren't we doing this in person? Like, why didn't I fly out to your studio to do this interview? But we can actually accomplish so much. And you would only be able to talk with 10% of the people if you had to go physically all around the world and arrange that to do it. And I really just naturally enjoy teaching. So when I get the chance to give a lecture or workshop, develop educational materials and put them together, I find that I'm able to take scientific material that, including with all the technical language, and kind of break that down so that an average individual who wants to better their health can understand it, and they don't have to go through a whole PhD program just to understand what's going on.
Yeah, it's a very valid point. I find all the studies that are out there, you present people studying, they're all just glazed over. They can't understand. I mean, it's like learning a new language. When you went to medical school, it's literally learning a new language, more or less, in many ways. So is your focus, having the background you have, is it primarily still psychiatric conditions that you primarily focus on? You mentioned emotional dialysis, which is obviously not psychiatric issue, although it does impact the brain. Well, what do you focus on these days?
I have always felt this way, that really every health problem is a health problem nonetheless. And it's always going to involve those three aspects in varying proportions. And the process of understanding the root cause is, a very similar path. And I think if you try to focus too narrowly, you'll actually miss important things. Like, I actually worked with an apprentice who was a family medicine doc right out of residency, and he knew he didn't want to work in that paradigm. And so he would observe some of my consults at the beginning before I was comfortable with him working individually. And he observed quickly on that someone would describe their issue as being a purely physical issue. And then when we start talking to them, it turns out that it's a purely psychological issue. And we call those a surprise psych consult, right? And I'm sure those happen in the hospital too. But if you are not, able to know how to interview and understand the psychological aspects, you might just miss that and approach it as purely physical. So I enjoy working with any kind of health condition, including autoimmune disease, cardiovascular disease, cancer, neurodegenerative disease, neurodevelopmental disease. And I think the difference is basically some of it is just that we have our unique individual body's way of expressing things. And that is often you can tie that to experience. Like, for example, I've had many people that in their formative years, they injure a certain part of their body. Maybe it's through sports or they fell off their bike or whatever it is. But then throughout their life, when they're sick, they develop symptoms in that area of the body. And it's no coincidence because the body like maybe never healed that, or it's a way for the body to express maybe detoxification through that part of the body. For some reason, a pattern developed. Just some teenagers get acne and some teenagers get heavy periods and some get a lot of belly fat and they express. And I think the causes of those three things are very similar, but individuals express it differently. And then we have my formulation of really what causes disease has to do with toxins, malnutrition, and trauma, either physical or psychological. My opinion is that explains really all health problems. And so different types of toxins are going to affect different systems of the body. So you can get at the root cause, like most heavy metals, for example, are going to have a neurological or neurotoxic component. They may also be cardiotoxic and GI toxic, but just like we know with alcohol, right? It has a pattern. It affects the cerebellum, the heart, the stomach, right? And other parts of the body, but those are, and liver. So we predominantly see, right? And even the pancreas. So we see all conditions of those particular organs with people that have had massive alcohol exposure. But if they're a cocaine addict, we see different problems. Right there, we might see arrhythmias or mini strokes or cardiac disease, things like that, cardiomegaly even, et cetera. We might see malnutrition because their appetite's suppressed and they don't eat enough. We can see these different patterns and get at the root cause. And then there's really the body. And this is a really key concept that's sort of so obvious, but we're not convinced of this in our medical training, that the body is the only thing that does the healing. When we put any substance in, whether it's a pharmaceutical drug or anything else, we're really just getting a response from the body. The drug itself takes no action, right? It has no capacity to perform. It just gets a response from the body. And if we have a cut on our skin and we do nothing to it, you'll see it just heal and disappear, right? And that's all the body healing it. And so any insult that we have that causes this disease, any part of our body is always trying to heal it. And a big principle is just how do you make sure you don't get in the way of your body's healing? And is there anything you can do to support what your body's doing? Like a simple thing, if your body's making a bunch of snot, you have a cold or allergies, if you get an neti pot and just provide some extra rinsing, you're just basically creating more snot and helping your body do what it's already doing. And maybe that will help your body complete it a little bit more efficiently.
You mentioned that the psychological part of every disease is physical and spiritual. How do you, obviously, the physical stuff, a lot of people want to fix your diet, let's keep it sleep, let's exercise, let's not be sedentary. How do you effectively address that psychological aspect? Is there obviously trying seeing cognitive behavioral therapy and all these different sensitization? How do you, what are actually, having seen this from another light now, what do you think is actually effective in that realm?
Yeah, so this is a little bit more challenging because my opinion is that everyone has to have their own individual path, and there's not a one-size-fits-all approach. Like you can look at some of the manualized therapies that have been developed, like you're talking about, like cognitive behavioral therapy. And I'll give an example with, military PTSD, right? Because I used to work a lot in the VA system. I saw lots of traumatized veterans, and some of them did really have the classic symptoms of PTSD, right? Where they have nightmares or they have a startle response where they hit the deck, right? When a firecracker goes off or if the doorbell rings, things like that. And there's manualized therapies that are different. And a lot of them are exposure therapy or related to exposure therapy. And if you get a workbook and it's a 8-week or a 12-week step-by-step program, and people do get some benefit from that, but they're not able to solve every problem with that, right? It takes a little bit more. They have to get completely through that and then start to develop themselves to get their level of functioning and complacency and happiness and all this other things together. So I try to offer with clients different options, some of them more kind of mechanized and protocol driven, like doing that, or a lot of times it might be working with a particular book, or even there's some types of therapists that they could work with as long as it's for a specific goal and it's time limited, that can be part of it. But I think the important aspects that I think are required, or at least have really increased the chance of success of getting at this, is 1, a contemplation exercise, 2, gratitude, some form of gratitude exercise, and then 3, some kind of ritual. So the contemplation is allowing yourself to sit with silence and stillness. So it's similar to meditation. It could be a form of meditation, but it doesn't have to be. It's just when you don't have any outside stimulus and you let thoughts come to you. And you can, what I call, set an intention for this, so I'm going to set aside 20 minutes every morning. I'm going to just sit and think, but I'm going to think, how do I make my life better? Or what was difficult in my childhood? Or these kind of things, and just let things surface. And as you do this on a daily basis, you start to understand what is going on with the problems that you're dealing with now. If you're having panic attacks now, if you lose your temper a lot with your wife, if you're having relationship difficulties, if you have no motivation to bond with your children, like whatever the issue is, you can sit and think on that and on a daily basis, and you're going to develop a lot of understanding, right? And then your next thing is you're going to have some ideas. Okay, what do I do now to move forward and heal, resolve from that, so that I can solve this problem in my life? And in order to keep yourself motivated to go through this process, you need to express gratitude also on a daily basis. And when you're saying, screw it, it's too hard, gosh, I'm addicted to sugar, I can't get over it, whatever it is, go back to the gratitude to remind yourself why you're doing this, that you already have a lot of good things. And even though this is hard, they're balanced out, that things are going to be even better once you deal with this, right? So that's the general strokes. And then everything else is going to be, I'm going to help a person recognize what that issue is. And like in that example I gave earlier with the woman who later in her life was having panic attacks because of a prank some teenage boys played on her back when she was 16, 17, 18 years old. For her, just the knowledge that was what was causing it was all she needed to heal from that. It was almost like there was a healing program in her brain that just needed that input, and then boom, it completed. And right. And then she never had to worry about that going forward. It just stopped it dead in its tracks. So people can have an experience, even with cancer. There's studies where they are like having real-time visualization of a tumor inside the body. And by the person doing a mental exercise, like a hypnosis or a meditation, they can see the tumor shrinking in real time, like over an hour or two. So it's impressive the way that people can heal, and you never really know how it's going to go for someone until they start on that journey.
Yeah, it's amazing how much our mind leads into the physical body, the somatization, all the healing. Yeah, I've seen that as well. People, just having some level of perceived support influence the outcomes. Unfortunately, we're about out of time. Can you, if there's any other points we did not touch on, you want to share? And if not, maybe share where people can find you, social media, websites, things like that.
We could have talked about a lot of things, and maybe we'll have another opportunity, but just to mention, eating carnivore foods is what helped me regrow my hair in a big way. And of course, there were some other parts to that equation. Also, Bart K and I had a nice discussion. I think we made a lot of progress understanding what really causes heart disease. And that's something I think we can always talk about in the future. I'm always developing new educational programs, and it took me a long time to understand really what is optimal about diet and nutrition. But please just go to my website, andrewkaufmanmd.com, and all my different offerings. And I even teach things outside of health, even into the law and sometimes the intersection, like about medical consent forms. So check it out. There's a lot of very good evidence-based material there that you might be interested in.
Awesome. Thank you very much. Enjoy the rest of your day. I'm sure hopefully we'll chat again, and appreciate you spending the time with. Thanks. Thanks, Dr. Kaufman. Appreciate it.
My pleasure, Shawn.